Hi, I'm Dr. Ken Berry, and in this video, I want to talk with you about 9 skin conditions that get dramatically better with a ketogenic diet. Have you ever went to the doctor with a skin condition and only to be told, well, we're not really sure what causes it. Here, use this cream or take this pill. It might help a little bit. You're just going to have to live with it. It might get better, but basically the take-home message is, I don't know what caused it. This might help. You're probably going to have to live with it. Well, in this video, you're going to learn about 9 different skin conditions that most doctors consider to be chronic and progressive that can actually get drastically better when you lower your carbohydrate intake, lower your intake of inflammatory foods, and eat a ketogenic diet. Now, if you haven't already done so, please consider clicking that subscribe button and the little bell right beside the subscribe button so that every time I have a bright idea that might improve your health, you'll get a notification from YouTube. Never in my 20 years have I seen a way of eating that was so therapeutically powerful at reversing chronic disease all over the human body, but definitely in the skin. I've seen this with my own eyes in my 20 years of clinical practice, back when I was recommending the DASH diet, the ADA diet, the Weight Watchers diet, the Jenny Craig diet. I never saw people's skin conditions get better. It just didn't happen. When I started recommending a low-carb, ketogenic diet, all of a sudden people would come back and say, this happened. Is that normal? This is better. Is that normal? I didn't refill my medication for this skin condition anymore since I've been eating this way. And the first few times I heard that, I wasn't really impressed because, things happen. But after I'd heard about 100 examples of that, I thought, maybe there's something to this. I've heard it now from scores of healthcare providers, both in person and online. First of all, asking me, how do I teach my patients to eat a low-carb ketogenic diet? And then a few months later, them messaging me and saying, I just had this chronic skin condition get completely better in a patient. Is that something that keto does? I've also heard from thousands of people, both in person and online, with stories of how their chronic skin condition that they really had no hope would ever get better, got better on a ketogenic diet. Now, first I want to tell you how I think this actually happens, and then we're going to talk about the 9 conditions that I have seen with my own eyes get better with keto, or have heard from literally thousands of people that keto makes it better. Now, what's the mechanism behind this? How does that work, right? I mean, is keto magic? No, I don't think so. But I think that keto is very physiologically powerful on the metabolism of the human body. And here's how. When you're eating the standard American diet or one of those other diets I mentioned, you're having chronic blood sugar spikes all through the day. That causes problems with your skin. You have chronic hyperinsulinemia from eating all the carbohydrates, and that absolutely leads to skin conditions, both the inflammation, the immune system, and the high blood sugar problems. There are inflammatory ingredients, even in health food, and if you don't know what they are, then you're going to suffer from chronic skin conditions. The ketogenic diet, if properly done, removes all those inflammatory components from your diet. You have chronic, bad, inappropriate inflammation. In so many of these skin conditions, that's what's going on. And then you have the final, but probably the most important thing for some of these skin conditions is you have autoimmune confusion. Your immune system is confused about where the boundary is between you and not you. And so your immune system starts to mistakenly attack cells that are part of you. A lot of doctors will talk about this, that your immune system is too strong and we need to weaken it. That's absolutely not true at all. You want a very strong immune system, but you also want it to be calm and wise so that it knows where the boundary between your cells and foreign cells, between your antigens and foreign antigens. And every skin condition I'm about to talk about is caused by, in some combinations, these 6 variables. That's what's causing every single one of these. And when you're eating a properly formulated, real, whole food, single ingredient ketogenic diet, you get rid of all those causes for these chronic skin conditions, allowing your body a chance to heal your skin. Now let's talk about the actual conditions. Number 1 is acne. And this applies for for children who are 9, 10, 11 years old with acne. This applies with 40 and 50-year-old men and women with acne. Your acne is going to get better when you follow the tenets of a well-formed ketogenic diet. Number 2, Skintags. I actually have a video on this channel about Skintags going away with keto. It's absolutely true. I've heard thousands of stories. I've seen it multiple times with my own eyes. Skintags are a sign of metabolic syndrome or chronic hyperinsulinemia. And when you lower the carbs and you lower the insulin, the Skintags either get smaller or completely fall off and go away. Next is psoriasis. Psoriasis is, many experts in the field say this is chronic and progressive. It's genetic. It's autoimmune. There's nothing you can do about it except take these expensive medications that have possible terrible side effects. I've seen psoriasis reversed and be 95% better for years after someone started a very low-carb ketogenic diet. A good rule of thumb that you can think about this is go back and look on the internet at photographs of people from the late 1800s and the very early 1900s. That's way before we had a lot of the inflammatory ingredients in our modern food supply. And it's way before people were eating way too many carbs. You won't see any of these skin conditions in those pictures. Or if you do, it's one person out of a million. That's the way it should be if we're eating the proper human diet. Number 4 is vitiligo. You may have heard recently Joe Rogan went carnivore, which is as close to zero carb as you can get. He did that for a month. And after 1 month, he could tell that his vitiligo was getting better. He was actually starting to fill in pigment in the depigmented areas. Huge. That's a huge deal for somebody with vitiligo because if it's severe enough, it can cause severe social consequences. Number 5, vasculitis. There's many different forms of vasculitis, but it's all caused by chronic inflammation and autoimmune confusion. When you remove those things from your body by removing the crap from your diet, all the vasculitises just get better. They may not go 100% away, but they're going to be so much better you won't have to worry about taking immune-killing prednisone or other medications. Next is eczema. Eczema, even in the tiniest baby who's on rice and corn formula, soy formula, those things are very inflammatory, and your baby's little cheeks will show you immediately just how inflammatory they are. Their skin may get very inflamed with eczema. The pediatrician says, I don't know, you must be genetic. I hear put this cream on there. Get the inflammatory foods out of your baby's mouth and the eczema will just go away. This applies to teenagers and adults as well. If you have chronic eczema, something in your body is causing one of the 6 things I mentioned earlier, and that's leading to your eczema. Remove the poison from your diet. It's a slow poison, no doubt. It's not going to kill you today or tomorrow, but it is keeping your skin inflamed, keeping your insulin high, and keeping your immune system confused. Next is rosacea. I personally have the tendency to have rosacea. And back when I was a younger doctor and I was eating just a standard American crap, and even when I was eating a paleo diet, I had to use a strong cortisone ointment, a strong steroid, 2 or 3 times a week on my rosacea to keep it from being obvious. Now I haven't put a steroid in my face in years, but eating a low-carb, real whole food, single ingredient ketogenic diet, it's just like I don't have it. And I've seen this in scores of other patients who were my patients personally, and then have heard all the stories online. Number 8 is hair loss. Early male pattern baldness and female pattern baldness are both exquisitely linked with metabolic syndrome. Metabolic syndrome comes from all the 6 things that I just talked about earlier. And so if you know somebody who's starting to lose their hair in their 20s, that is the first sign that they are developing metabolic syndrome. Some people express it by getting fat. Some people express it by getting diabetes. Some people express it by losing their hair. Hair loss absolutely is going to slow down when you eat a well-formulated ketogenic diet. Then number 9, and this is going to really piss off some dermatologists, is skin cancer. Skin cancer is not caused by the sun. Skin cancer is not prevented by anything that you slather on your skin at all. Skin cancer is caused by building weaken skin cells by eating a crap diet, and then with the chronic inflammation and the chronic immune confusion, we all have cancer cells that develop in our skin probably every day, but our immune system, if it's calm and intelligent, is able to root out the cancer cell and nothing comes of it, and you never know. But if your immune system is chronically confused and your skin is chronically inflamed, you're going to get skin cancer much more commonly. Now, if you've reversed one of these skin conditions with the ketogenic diet, with the low-carb diet, the Banting diet, the Atkins diet, or the carnivore diet, please tell your story in the comments, because there are so many new people coming to this way of eating and they just can't believe it. It sounds like magic. Like, this can't be right. My doctor said it. We don't know what caused it and there's no cure and I'm stuck with it. But now this guy's telling me I can actually make it 95, if not 100% better by eating certain foods and avoiding other foods. Please put your story in the comments so that these newcomers can see basically their story, but with a happy ending. That's gonna be the thing that helps them go, okay, I'm gonna give this a try for a month. Now, if you know someone suffering from any of these conditions and they don't yet know about keto, please consider sharing this video with them. You can send a link in an email, in a text message, on your WhatsApp. You can share it on your Facebook, wherever. But please help people who think that these chronic skin conditions are just a curse that they're burdened with for the rest of their life. That's just not the case. If my videos have helped improve your health in some way, please consider clicking on my Patreon link. It's right down below in the show notes. It's a quick sign up and you can throw a buck or two my way so that I have more time and more resources to make videos just like this. This is Dr. Barry. I'll see you next time.